Hello, my name is Tim Bruckner, and I am an Associate Professor of Public Health at the University of California. WHO, with the financial support of the Global Fund, has commissioned the development of a tool to estimate the potential impact of investments in human resources for health on service coverage for HIV, tuberculosis, and malaria interventions, and the corresponding lives saved. The tool also allows developing estimates of health workforce requirements to attain desired levels of service coverage. To this end, we have created two user-friendly workforce calculator tools to assist country officials with developing such estimates. This brief presentation will guide you through the two separate tools. Additional technical details regarding the tools are available through WHO and the Global Fund. There are two workforce tools contained in two separate Excel files: the Lives Saved tool and the Coverage Target tool. I will first review the Lives Saved tool. The Lives Saved file answers the question, how could health workforce investments in my country translate into lives saved due to increased treatment coverage for HIV, tuberculosis, and malaria? After you open the Lives Saved tool, note that there are many tabs contained in the tool. The red README tab contains the full set of instructions for using the tool. Reading the full contents of the README tab is encouraged before using the Lives Saved tab. The blue Lives Saved tab is the main sheet for the tool. There are many tabs to the right of Lives Saved which contain information that provides the basis for calculations. Users are asked not to edit any of the tabs to the right of the Lives Saved tool. Click on the Lives Saved tab. Every blue cell represents the input that is required by you, the user. Please take a moment to review the blue cells throughout the tab. There are also green cells, which are populated using calculations that are contained in other tabs. Users are asked not to edit any of the green cells, since that could affect the functionality of the tool. The user would begin by entering their country of interest, as well as information about the HIV, TB, and malaria burden in the country. Next, the user would fill in the blue boxes in rows 16 through 26 and 33 through 35, which represent workforce investments in pre-service education, new hires, pay raises, in-service training, and incentives. These investments are to be filled in separately for doctors, nurses and midwives, and community health workers. If the country additionally has clinical officers, they could input investments under the CO, or clinical officer column, and additionally fill out the relevant cells in S7 and S8. To illustrate the functionality of the Lives Saved tool, I will show an example in which I use a fictional country with a specific set of desired workforce investments. This fictional country shows a high HIV, TB, and malaria burden. Much of the workforce investments involve training new nurses as well as community health workers, although there are some investments in increasing productivity among the current workforce. As we scroll down to row 38 and below, the investments are translated into treatment service coverage for HIV, TB, and malaria. These treatment service coverage increases, in turn, result in additional lives saved. The additional lives saved are shown in columns N and O. Beginning in row 73, we have the final output of lives saved as a result of all components of workforce investments. In this fictitious example, the country's investments translate into 279 additional lives saved due to increased treatment of HIV, TB, and malaria. If the user then wants to estimate the lives saved due to a different investment scenario, then they would scroll up to row 2 and click the Reset All button. Now I will move to the second tool, the Coverage Target tool. This file answers the question, what would be the estimated number of additional health workers needed to achieve the desired benchmarks of treatment service coverage for HIV, TB, and malaria? As with the Lives Saved tool, there is a red Read Me tab. Users are encouraged to read the information in this tab before working with the Coverage Target tool. Then there is the Main Coverage Target tab. We will enter data only in the blue cells. Users are advised not to edit the green cells, as this will compromise the functionality of the tool. Users are first asked to select the country of interest in cell C3. The population and income level and current treatment coverage of that country will auto-populate. However, if users have newer information than the figures in current treatment coverage in cells C11, 12, 13, and 14, they are welcome to enter new figures into those blue cells. Now we will turn to a fictitious country to illustrate the functionality of the tool. This country has a doctor, nurse, and midwife concentration of 0.25 workers per thousand population, and treatment coverages that range from 54% to 84%, depending on the treatment. If we wanted to raise tuberculosis treatment coverage to a desired level of 70%, the calculator now estimates that an additional 17,251 workers would be needed to attain that level of treatment coverage. If the user would like to use other benchmarks, then they would press the Reset button, a cell C8, to return to the desired coverage levels to their default values. Thank you for your interest in the two calculator tools. The tool is available for download on the WHO website. For further information, you can contact Workforce 2030 at who.int.